You wake up with a splitting headache. You pop an ibuprofen, drink some water, and move on with your life. Total time invested, maybe 45 seconds. Now imagine waking up with that same headache, 50,000 years ago. No pills, no pharmacy, no doctor, no internet to self-diagnose yourself with 17 different rare diseases. Just you, the pain, and a cave full of people who are equally clueless about what's happening inside your skull. Here's the thing nobody really thinks about. Humanity didn't have modern medicine for 99.9% of its existence. And yet somehow, against genuinely ridiculous odds, we survived long enough to invent hospitals, antibiotics, and the ability to complain about hospitals and antibiotics on social media. So how did ancient humans actually do it? How did they treat injuries, disease, infections, broken bones, childbirth, and every other biological catastrophe the human body is capable of producing with absolutely nothing we would recognize as medicine today? The answer is stranger, more impressive, and honestly more disturbing than you probably expect. Because it turns out ancient humans weren't just bumbling around hoping for the best. They were experimenting, observing, and developing real medical knowledge thousands of years before anyone thought to write it down. And some of what they discovered, we're still using it right now, this morning, in your medicine cabinet. This is the story of how humanity figured out healthcare by doing absolutely everything the hard way. Let's start at the very beginning, which in this case is somewhere around 2 million years ago, when our ancestors were still more interested in not getting eaten by large predators than in developing a healthcare system. Early hominids almost certainly relied on the same basic instincts every animal does when injured or sick: rest, lick wounds, avoid food, seek warmth. Watch a dog after surgery, and you're basically watching a behavioral blueprint that stretches back millions of years. These aren't learned behaviors. They're biological defaults. And they work, at least for minor problems. But here's where things get interesting. Somewhere along the line, our ancestors started doing something no other animal does consistently. They started deliberately using plants. We know this because chimpanzees, our closest living relatives, already do it. Chimps have been observed seeking out and consuming specific plants when sick, plants they don't normally eat and clearly don't enjoy eating. They'll swallow rough leaves that physically scrape parasites from their intestinal walls. They'll chew bitter pith from trees that contain compounds toxic to the exact parasites affecting them. They're not doing this for the taste. They're doing it because it works. And somehow they figured that out. If chimps have this ability, there's every reason to believe early hominids had it too. In fact, they probably had it better because humans have something chimps don't in large quantities: the ability to share information across generations, to teach and learn, to accumulate knowledge over time. Which means the very first medicine wasn't invented. It was noticed, and then remembered, and then passed on. That distinction matters more than it sounds. An animal that eats a plant and feels better has a useful behavior. A human who eats a plant, feels better, and then tells everyone else about it has the beginning of a medical tradition. One observation, shared at the right moment, could save dozens of lives over the following generation. And those people would share it with the next generation. And on across thousands of years until a body of knowledge existed that no single person had created, but that everyone benefited from. That is, quietly and without any fanfare, the origin of medicine. Now brace yourself, because what comes next is one of the most extraordinary discoveries in the entire history of archaeology. In 2023, researchers working in a cave in Borneo found something that stopped them cold. They were examining a skeleton dating back approximately 31,000 years, and this skeleton was missing part of its left leg. Not because it was lost over time, because it had been surgically amputated. The cut was clean. The bone had regrown around the wound, which means the patient didn't die immediately. They survived. A surgical amputation performed 31,000 years ago, before agriculture, before writing, before anything we associate with civilization. Let that sink in for a second. Someone, 300 centuries ago, looked at a person with a severely damaged leg and thought, we need to cut this off. And then they did it. And the patient lived, probably for years afterward, in a jungle, on one leg, in the Stone Age. This discovery completely rewrote what scientists thought they knew about prehistoric medicine. Before this find, the oldest confirmed surgical amputation was a few thousand years old. Now we're looking at surgical procedures being performed during the Ice Age, with stone tools, with apparent success. And this wasn't a one-off. Across archaeological sites worldwide, we find skulls with holes in them, carefully drilled, shaped holes not from violence, but from a surgical procedure called trepanation, which involves removing a section of the skull, presumably to relieve pressure, treat seizures, or address head injuries. The really wild part? A significant number of the patients survived. We know because the bone grew back around the holes. People had brain surgery in the Stone Age, with flint, and many of them were apparently fine afterward, which raises an obvious question. How on earth did the surgeons know to do that? How did they know it would help? How did they know how to do it without killing the patient on the spot? The honest answer is, we have no idea. What we do know is that they figured it out somehow through a process of observation and experimentation that we can barely imagine. Because most of the experiments probably didn't end well. There was no ethics committee. There was no peer review. There was just someone willing to try, a patient desperate enough to let them, and the slow, brutal accumulation of knowledge about what worked and what immediately made things catastrophically worse. The fact that trepanation became a widespread, practiced procedure across multiple unconnected cultures on different continents suggests it worked often enough to be worth repeating. And that is, in its own grim way, remarkable. Somewhere between noticing that willow bark helped with pain and understanding that it contains a compound chemically similar to aspirin, there are about 5,000 years of humans chewing on things and seeing what happened. And this is where ancient medicine gets genuinely impressive. Archaeological evidence shows that Neanderthals, who are not even fully modern humans, were already using medicinal plants. Excavations at Shanidar Cave in Iraq found pollen deposits from multiple medicinal plants around a Neanderthal burial site dating back 60,000 years. Whether those plants were deliberately placed there is debated, but other Neanderthal sites have yielded direct evidence of plant use, including residues found in dental calculus, which is essentially fossilized plaque, showing that they were consuming plants with known medicinal properties. Yarrow, groundsel, plants still used in traditional medicine today. By the time we reach ancient Egypt, around 3000 BCE, the medical knowledge base was frankly astonishing. The Ebers Papyrus, written around 1550 BCE but containing knowledge far older, lists over 700 remedies using hundreds of different plants, minerals, and animal products. It describes treatments for inflammation, infections, digestive problems, skin conditions, eye diseases, and psychological disorders. Some of these treatments were genuinely effective. Honey, which they used extensively for wound care, is a real antimicrobial agent. We know this now. It works because its low moisture content, acidic pH, and hydrogen peroxide production create an environment where bacteria cannot easily survive. The Egyptians didn't understand the mechanism, but they had noticed through direct observation that wounds treated with honey healed better than those that weren't. Garlic, which they also used extensively and which workers building the pyramids apparently consumed in enormous quantities, has real antibacterial and antifungal properties. When ancient healers prescribed garlic for infections, they were accidentally doing the right thing. Willow bark for pain and fever, aloe for burns, opium poppy for pain relief, which the Egyptians used, and which works because of the opioid receptors in our brains that nobody knew existed for another few thousand years. These weren't just lucky guesses. They represented thousands of years of accumulated empirical observation. Nobody knew why these things worked, but they knew that they worked, and that knowledge was considered precious enough to be written down, preserved, and passed on. And here's where the story becomes almost poetic. The people who held this knowledge, the healers, the shamans, the midwives, the herbalists, were among the most important members of any ancient community. Not because they were always right, but because they were the repository of everything the community had learned about staying alive. Losing that knowledge to disease, violence, or the simple failure to teach it to the next generation could mean a community that had survived for centuries, suddenly losing the ability to treat a wound that became infected, or a fever that needed managing, or a birth that was going wrong. Knowledge was medicine, and medicine was survival. Here's the part that puts the whole story into perspective. Germ theory, the idea that infectious diseases are caused by microorganisms, wasn't established until the 1860s. Before Louis Pasteur and Robert Koch did their work, nobody on Earth understood what actually caused most of the diseases that were killing people in enormous numbers. No one. For all of human history, which means every single medical tradition that existed before the mid-19th century was operating without the most fundamental piece of information needed to understand disease. They didn't know about bacteria. They didn't know about viruses. They didn't know that the reason a wound got infected was because microscopic organisms were colonizing it and reproducing inside the tissue. Instead, they had other theories. Greeks believed disease came from imbalances in 4 bodily humors: blood, phlegm, yellow bile, and black bile. Getting sick meant one of these was out of proportion, and treatment meant bringing them back into balance. Which is why bloodletting, the practice of deliberately draining blood from a patient, remained standard medical practice for over 2,000 years, and probably killed more people than it ever helped. The Chinese had a system based on vital energy flowing through the body. Ayurvedic medicine in India worked with the concept of doshas. Virtually every culture developed its own internal model for how the body worked and what happened when it went wrong. None of these models were correct in the way we understand disease today, and yet here's the fascinating part. Some of the treatments derived from these incorrect models worked anyway, because ancient healers were empiricists before they were theorists. They observed, they tried, they kept what worked and discarded what didn't. The theory might be completely wrong, but the prescription sometimes landed on something real by accident. Mold has been observed in ancient Egyptian medical contexts, with preparations containing mold applied to infected wounds, mold that produces penicillin. Ancient healers using primitive antibiotics without knowing what antibiotics were, 2,000 years before Alexander Fleming noticed the same effect and got a Nobel Prize for it. The model was wrong. The result was right. And that, when you think about it, is a genuinely impressive achievement for people who had no way of seeing what was actually happening at the microscopic level. Let's talk about trauma, because this is where ancient medicine gets its most direct, immediate, and well-documented results. Broken bones heal on their own if immobilized correctly. This is not complicated medicine. It requires only the observation that if you keep a broken limb still and supported, it knits back together. And the archaeological record shows that ancient humans were doing exactly this as far back as we can see clearly. We have Egyptian mummies with healed fractures that show evidence of splinting. We have Greek texts describing fracture management in remarkable detail. We have Roman surgical instruments excavated from sites across Europe that are recognizably similar to tools surgeons were using in the 19th century. Battlefield medicine, in particular, drove enormous advances in surgical technique throughout the ancient world. The Roman army was arguably the most medically sophisticated fighting force in the ancient world, not because Romans were particularly enlightened, but because keeping soldiers alive was a practical military necessity. Roman legions had trained medics. They had field hospitals. They had surgeons who specialized in removing arrows and spear points, cleaning and closing wounds, and managing the inevitable infections that followed. Roman military medicine was probably the most advanced trauma care system the world had seen up to that point, and its techniques remained largely the standard for over 1,000 years after the empire fell. But here's the thing that doesn't get talked about enough. Survival in the ancient world was fundamentally a collective project. Individual humans are not well designed for survival alone. We have no claws, no armor, no exceptional speed. We're slow to mature, vulnerable when injured, and dependent on others for care when sick or hurt. The biological reality is that for most of human history, if you got seriously injured or ill, you survived because other people helped you. And those people had knowledge, specialized knowledge accumulated over generations, held by individuals who had dedicated their lives to healing. Shamans, healers, midwives. The people in every community who knew which plants did what, who could set a bone, who understood how to manage a difficult birth. These were not primitives guessing randomly. They were specialists practicing a tradition, operating within frameworks that, for all their theoretical flaws, were built on real observations of what actually worked on real human bodies. The social fabric was itself a form of medicine. Isolation is bad for recovery. We know this scientifically now. Ancient humans knew it practically, because sick people who were cared for by their community survived at higher rates than those who weren't. And communities that recognized this and built care into their social structure outcompeted those that didn't. Evolution doesn't just select for bodies, it selects for behaviors, and caregiving, it turns out, was selected for very heavily indeed. Let's be honest about something. Ancient medicine saved a lot of lives. It was genuinely impressive in many respects. And it also failed catastrophically on a regular basis, in ways that we have largely eliminated from modern life, and mostly forgotten to be grateful for. Childbirth is the most obvious example. Before modern obstetrics, giving birth was one of the most dangerous things a woman could do. Maternal mortality rates in pre-modern societies ranged from roughly 1 to 3% per birth, which sounds small until you consider that women typically gave birth multiple times. Over a lifetime, the cumulative risk of dying in childbirth was substantial. For much of human history, a significant fraction of women died in the process of giving birth. Infant mortality was even more stark. In many ancient societies, half of all children born would not survive to their 5th birthday. Not because people didn't care, not because they weren't trying, but because infections, malnutrition, and diseases that are now either preventable or treatable were simply part of the landscape of childhood. Fever is a good example of both the limits and the ingenuity of ancient medicine. Fever itself is actually a useful immune response, which some ancient healers intuited. Egyptian and Greek medical texts both describe managing rather than eliminating fever in some cases, allowing it to do its work while keeping the patient hydrated and comfortable. But when fever came from serious infection, particularly sepsis, the systemic infection of the blood, there was essentially nothing that could be done. Sepsis killed quickly and completely. It still kills people today despite antibiotics and intensive care units. Without those tools, it was almost universally fatal. What ancient humans had in these cases was what we might generously call compassionate care, keeping the patient warm, giving them water, administering whatever herbal preparations might reduce discomfort, being present, not abandoning them. And sometimes the immune system won anyway. The human body is remarkably capable, given half a chance. We are, when everything else is stripped away, extraordinarily well-designed machines for surviving things that should kill us. Our immune systems are sophisticated. Our capacity for tissue repair is impressive. Our psychological resilience, when supported by community, is genuinely extraordinary. Ancient healers couldn't always fix what was wrong, but they created the conditions, physical comfort, social support, herbal assistance, reduced stress, that allowed the body's own systems the best possible chance of doing the job themselves. That is not nothing. In many cases, it was everything. The honest picture of human health before modern medicine is one of genuine hardship, real ingenuity, and constant negotiation with a body that is simultaneously incredibly resilient and startlingly fragile. People died young. They died of things that wouldn't kill anyone today. They suffered from conditions that could now be cured with a single course of antibiotics. They lived with pain that we would consider completely unacceptable by contemporary standards. A bad tooth infection could kill you. A minor wound could become septic within days. A chest cold could turn into pneumonia with nothing to stop it. Giving birth was a genuine gamble. Surviving childhood was a genuine achievement. Living past 50 was, in many times and places, a notable accomplishment. And yet people did all of these things, communities persisted, populations grew. Civilizations were built by people who were, by our standards, medically completely unprotected, because they had knowledge. Imperfect, sometimes dangerously wrong, but also sometimes brilliantly right. They had community. They had accumulated observation. They had the specific, hard-won understanding of their local environment. Which plants grew nearby that helped, which animals could be used for, what signs meant recovery was coming, and what signs meant preparing for death. They also had something that is easy to underestimate: remarkable psychological fortitude. A culture in which death and serious illness are constant features of everyday life develops a relationship with those things that is fundamentally different from ours. Not callous, not indifferent, but clear-eyed in a way that we, living in an era of extraordinary medical protection, genuinely struggle to imagine. The ancient healer sitting cross-legged with a stone mortar, grinding medicinal herbs, whispering knowledge down to an apprentice who will whisper it down to another, across thousands of years and thousands of miles, was not doing something primitive. They were doing science in the oldest sense of the word: observation, hypothesis, testing, revision, preservation of what worked. The difference between them and a pharmacologist in a modern lab is not the quality of the thinking. It's the tools, the accumulated knowledge base, and the extraordinary privilege of knowing what a bacterium is. Here's the part that might genuinely surprise you. A significant fraction of the medications used in modern pharmaceutical medicine are derived from plants or are synthetic versions of compounds originally found in plants. The World Health Organization estimates that around 80% of the global population still relies primarily on plant-based medicine for their primary health care. Not because they don't know about modern medicine, but because that's what's available, and because much of it actually works. Aspirin came from willow bark. Morphine came from the opium poppy. Quinine, which saved countless lives treating malaria, came from the bark of the cinchona tree used by South American indigenous peoples for centuries before Europeans arrived and wrote it down. Artemisinin, one of the most effective modern malaria treatments, was derived from sweet wormwood, a plant used in Chinese medicine for 2,000 years before anyone isolated its active compound. Digoxin, used to treat heart failure, came from the foxglove plant, which folk healers in Britain used for heart conditions for centuries before William Withering formalized the treatment in 1785. Taxol, one of the most important cancer drugs in modern medicine, came from the Pacific yew tree. Vincristine, used to treat childhood leukemia, came from the periwinkle flower used in traditional medicine in Madagascar. The ancient pharmacopoeia, the accumulated knowledge of which plants affected the human body and how, built up through tens of thousands of years of empirical observation, represents a genuine scientific resource. One that modern pharmacology has been methodically mining for decades. One that ethnobotanists argue we are destroying, along with the rainforests and the indigenous communities who hold the last living fragments of that knowledge. When we dismiss ancient medicine as superstition, we miss the part where modern medicine is standing on its shoulders, quietly grateful and occasionally not giving nearly enough credit. Ancient humans survived before medicine because, in a very real sense, they invented it. One painful experiment at a time. One observation passed down to one apprentice. One wound treated with honey because someone 100 generations earlier had noticed that honey helped. One fever managed with willow bark because the knowledge had traveled somehow across thousands of miles and thousands of years to the person who needed it. The chain is unbroken. From the Neanderthal chewing bitter pith in a cave 60,000 years ago, to the Egyptian physician pressing a honey-soaked dressing to a wound, to the Roman army surgeon pulling an arrowhead from a soldier's thigh, to the Chinese physician prescribing sweet wormwood for fever, to the laboratory where a researcher is right now testing a compound first identified in a plant used by a community that has known about it for centuries. It's all the same thing, the same impulse, the same project, trying to understand the body, trying to keep it alive, passing on what works, and if any of that made you feel slightly better about the ibuprofen you took this morning, good. You're standing at the end of a very long line of people who were trying to solve the exact same problem you had. They just had to do it the hard way first. So the rest of us wouldn't have to. Let me know in the comments what video you want me to make next. See you soon.